have some folks here from the Everett Clinic. Here, at this point, I will turn it over to Marcy.
Thank you, Susie. Good afternoon, council members. My name is Marcy Hammer. I'm one of the HR managers here at the city overseeing the benefit plans. And so today, benefit plans, I also have two guests that are going to be co-presenting along with me. I'll let James first quickly introduce himself.
Good afternoon, everybody. I'm James Johnston, the Regional Director of Operations for the Puget Sound and Portland Division at Verahole Health. It's great to be here. Thank you.
And Britt?
Yeah, hi, my name is Britt Woldridge. I'm an employee benefits consultant working with Alliance Employee Benefits and working with the city of Everett around your employee benefit programs.
Thank you. So I'm going to go ahead. Hopefully everybody can still see my screen. I'm going to talk a little bit about where we stand as far as budget goes and our health insurance plans that are self-funded. So we'll talk a little bit about enrollment and where we've been. We'll also talk a little bit about the annual claim experience and what our utilization looks like year to date and where we've been since 2020. So if you all recall, back in, well, it's been quite a few years now that we've been working on the introduction of a second self-funded insurance plan, which is also administered by our third-party administrator, HMA. We have a consumer-driven health plan. The consumer-driven health plan has the option of a employer funded. At 2020 was the establishment of the Verahole Health Clinic. And so the consumer-driven health fit, we still have some groundwork to do on encouraging more of our employees and their families to go and since 2020, we started with an employee enrollment of 242 employees. We are at 306, half of our self-funded plan participants, which is just typically under right around 900 total employees that are on an HMA plan. This is, of course, in comparison, you can see in the light turquoise column to our PPO plans. So you can see that that is actually coming down over the years. So that's the traditional preferred provider plan and more rich plan design that the city has had for quite some years. Next, we'll take a look at the claims experience and how this goes against our budget, and I'll kind of walk from left to right. This is for 2020 and 2021, so you have 2 full years of look back on how that consumer-driven health plan has ran. You can also take a look, starting on the left column, the average monthly enrollment. So in 2020, like we mentioned, we started out brand new with the consumer-driven health plan. We only had 242 enrollees on the plan, and most employees stuck with the PPO operation costs, which includes both stop-loss insurance as well as administration costs to HMA, and the comparison between the two plans. The next column goes over actual claims and clinic costs. So you can see the cost of the clinic in that first year was substantial, as we did have, that was when we established the clinic, so there were more costs in 2020. And then you can take a look at what the total just plan costs. This does not include stop-loss insurance. When looking at the budget, you can see that the traditional PPO plan ran just over 1% of budget. You can see when I mentioned the consumer driven health plan ran at 77% of total budget cost. And finally, when you're taking a look at this is a lot of numbers, but when you're taking a look at this and what we're paying per employee per month, the consumer driven health plan, it was $940. And then the cost per employee per month for the Everett Clinic and their services was $142. Does anybody have any questions about the layout of the claims experience? And I'll move on to 2021. Okay, note too, who would have thought that we opened our near site clinic in January of 2020, and then a global pandemic took off in March of 2020. So really it's remarkable in my mind how well the consumer-driven health plan has performed, and the Everett Clinic as well. And James will talk more about that as he walks through those slides. In 2021, we did have more migration to that consumer-driven health plan. So you can see we increased to 322 individuals that were enrolled for an average monthly enrollment. And you can see actually that the PPO, or that traditional plan, ran a lot higher from a budget standpoint. So that ran at 121%, which was about $1,760 per employee per month. And you can see that although the consumer-driven health plan creeped up about 10%, that just means that there was more migration to that plan. You can also see that the Everett Clinic costs were running a little bit hot or high in the year 2021. And really, I'll let James talk to this as we're flowing through the clinic, as well as just more cost in general related to COVID. So the COVID vaccine took off in 2021, so we just had higher expenses than what were budgeted. Taking a look at 2022 year to date through July, you can see again, we've increased migration to the consumer-driven health plan. You can see that the traditional PPO plan continues to run above budget. And that typically is because of the plan design and the rich plan design. So the costs that are absorbed by the city are much higher. There's much less employee liability than the consumer-driven health plan. The consumer-driven health plan ran at 70% of budget. And as mentioned, we're still, in the pandemic, and the Everett Clinic costs are still running a little bit high at 109% comparatively to budget. So with that, does anybody have any questions before we move on from the claims experience? And I'll talk a little bit about the future and, kind of our plans that we're going to put in place to encourage growth on the consumer-driven health plan.
Marcy, so for the clinic expenses, what specifically are the types of increased expenses because of COVID? Is it just more PPE? Is it what is driving those cost overage?
Yeah, and James, do you want me to initially answer, or would you like to take that one?
I'd be more than happy to answer, Marcy. I'll leave that up to you.
Oh, go for
it. Yes, thank you. I would say that when it comes to the cost, some of the items that Marcy had mentioned earlier, there's some pharmacy and startup med costs that certainly increased. There was a pent-up demand, especially over the course of the last 18 months for healthcare. The vaccines and booster shots that came in were also and there's been some support in the amount of staff hours as well to support some of those efforts, especially with the vaccinations and shot clinics as well. So those, I would say, are the areas that probably resulted in the higher costs.
It was my understanding, maybe I don't understand this, but I thought the COVID vaccines were being provided by the federal government, or were you having to pay for those?
There was the state of Washington, but there was some cost associated with that.
And I mean, I felt like maybe in the last year, it seemed like people were going to the doctor less because they kind of felt like it's, you know, a lot of people were worried about safety and getting COVID still. Do you have statistics for the number of visits you're like, just the cost per visit is going up?
We will, yes, that's actually a great question. We'll show some information on engagement and utilization here in a couple of slides. I would definitely say that 2020 saw less visits. People were avoiding the doctor ED visits as we started to get the vaccinations, and our engagement certainly increased during that period.
And I'll just note as well, the clinic did continue to, they had to kind of do a business or a pivot, and still continued to provide telehealth services. And so that also, statistics on that, but kind of that gap between 2012, but not really widely available. There was an increase in telehealth visits as well.
That's a great call out, Marcy.
Okay, thank you. That's all I have. Councilmember Schwab, any questions?
Okay. So this is where I hand it over to James. He's going to go over Vera and where we've been so far. And James, if you want to clue me in.
Sounds great. Thank you, Marcy. So again, wanted to take a brief look here at some of the key areas for Vera, especially over the last 18 months or so, starting in 2020. The data that you're looking at here is actually related to fiscal year 2, which was 2021. So overall, you had high member experience scores or patient set as 0.0, and we'll talk about that score, which is a net promoter score. And I'll talk in greater detail about what that means as well, of 84, an exceptional score, especially in the world of healthcare. Obviously, population health, typically we would have a provider kind of provide more information on that, but the number of vaccines that were provided were 321, so very strong numbers there. Engagement, as we talked about earlier, 63% for employees. That did end up meeting the performance guarantee of 60% for 2021. And a strong spouse and partner and dependent performance engagement as well at 25%. We had 470 wellness visits. Those are the 1 hour long visits where individuals receive their biometric screenings. They'll spend quite a bit of time with a provider and then have a coaching connection as well. There were 892 coaching visits, which is very good. Coaching is a strong key and differentiator of our Vera services. And we did have 80 CDL visits, which are specific to the city of Everett as well. As I noted earlier, our performance guarantees, there are 3 of those. We ended up meeting 3 of 3. That includes employee engagement, annual whole health examination, or otherwise known as the wellness visit, and patient satisfaction as well. And highlighting some of the things that we've seen thus far or will continue to implement in 2022 and beyond. We'll have flu shot events coming up here very shortly, actually starting today. There is some availability that we will be promoting in the coming days. Group coaching workshops, and introduction of a new diabetes and nutrition education program, which is a focus of the organization. Integrated behavioral health, which will start in January of 2023. Very excited about that and the need there. The reintroduction of a whole health council and a post-offer physical program along with the contract renewal that will also be due at the end of this year as well. Next slide, Marcy. So looking at engagement in greater detail, you'll see the green line is year one, so a little bit lower in the first year of the pandemic. The yellow line is year two, and the orange line is to date, or at least as of the end of June, or through May, I should say, of 2022. So we are projecting increased engagement over last year. And we certainly saw an increase from year one to year two. I'll pause for a moment just to see if there are any questions related to engagement.
Yes, I have a question, Terry.
Go ahead, Councilmember Schwab.
As far as engagement, I am aware that, at least in the fire department, they have a peer support team. I was wondering if I want to give you the idea of engaging in the peer support groups. I'm not exactly familiar if the police law enforcement have something similar, but I do know that there is a chaplaincy program that the police department has that the focus is a lot on our residents, but they are also aware of particularly challenging events for emergency responders. And I was wondering if there was a plan or even a thought about engaging those groups. Thank you.
Based on eligibility, Marcy, I'll defer to you on that one.
Yeah, so on the previous slide, there was the notation on an integrated behavioral health clinician, and that is something that we are working with the Vera team on. We're in the very early stages, but our timeline for that is for 2023. One thing that I've asked Vera in reviewing that kind of new added benefit, right? Something different to the clinic. And I think everybody has seen, obviously, in the media, but within our own population and our own community, the need for more mental health support, especially for our first responders. So initially, as far as the peer support team goes, I asked Vera that we would have a representative from each of our peer support teams to basically be part of that interview process or hiring process for the integrated behavioral health clinician. So there's going to be more information to come because we're in the very early stages, but it's something that I definitely have been working on and making sure that, especially because this health clinician is going to be so personal to our employees and their families, that we also need some buy-in too from groups like peer support, et cetera, to make sure that if we offer something like this, that the value is going to be there. And so definitely hear your feedback on the peer support, and our focus for 2023 is really on the well-being of our employees and their families. And so this is just one step in that direction, is engaging the peer support teams.
I also think that if there's some value there for the first responders, that's an avenue for a bridge to build trust and a relationship with the program that may encourage other employees to take a look at it.
Yeah, definitely. Yeah, for sure.
Turning our attention to patient satisfaction. So as I noted earlier, in year one, we had a 5.0 patient satisfaction score. So exceptional. You can't get any better than that. In year two, as we saw more patients, we did end at a 4.8. Our Vera average is 4.7. So certainly above average. and definitely considered excellent when it comes to that. As you can see on the left-hand side, there is a sample of some of the questions and where we scored in those particular categories. And then touching on what is called the Net Promoter Score, or NPS, that is a question that is within the survey. It's a very common practice within all industries. Apple, Google, large retailers use this as a measure of patient satisfaction. In this particular case, it's a single question of would you recommend Vera to a coworker or colleague? In this particular case, Vera averages an 80.7 in 2021 and an 81.3. I would say at this point, the city of Everett is meeting or exceeding that, especially in year 2. We did see a little bit of a dip in year 1. And certainly you can see a little bit of a trend down for year 3 thus far. We do expect those numbers as the number of visits increase to actually go up. And in fact, since this was taken a couple of months ago, there has been an increase in that score. One thing I should note is the average in healthcare, in the healthcare industry, is 31. So Vera has always done a phenomenal job of having high NPS scores, and of course, meeting the needs of our patients when it comes to their satisfaction.
Question. What was the participation rate of the survey?
Participation rate, so our target is 15%. I don't have the exact numbers, but off the top of my head, I believe that we were slightly under that at 13.7, but I can confirm what that was.
Close enough, thank you.
One interesting note about patient satisfaction is typically the more surveys that you receive, the better scores or the better overall score you'll receive. And I did want to just quickly pause for a moment, and here are some patient comments that were taken over the course of the past 18 months regarding the Vera and the Central Everett team and our services. I'm certainly not going to go ahead and read them for you, but we'll take a couple of seconds here, and I'll allow you to peruse them.
And I think this is really important and really resonates with the employee team because it's one thing to look at, like a net promoter score. That's not going to really resonate with a frontline worker, but hearing their peers and their families have the comments about their experiences. I can maybe, count on one hand, maybe the negative feedback that I've received. It's been, and everything that I've ever received is fixable. Like we are able to resolve it, and Vera is very quick to respond to make any necessary corrections. So I just thought this was important to share as well, along with that net promoter score too.
So looking at our cost analysis, and Marcy, feel free to go to the next slide. So it's important that Vera, as we come in, that we are delivering cost or care at our cost, as noted here. The past couple of years have been certainly unconventional in the fact that, again, there have been interesting patterns as far as how people are approaching their healthcare. Overall, here you can see there is a net savings loss of $35,000 and an ROI of a negative 2.6. But I think considering where we are and the fact that there were costs that we weren't anticipating in 2021, again, we saw an increase in overall services and demand for our services. This actually takes your book of business or your claims. And what we do is we measure against that. So we use various methodologies to actually determine if we are saving the city of Everett money. And we are very confident that in year 3, as we are seeing things trend in that direction, that we will certainly see both net savings and ROI in the green as we are currently trending in that direction for this year, even though we're still continuing to see costs a little bit higher than originally anticipated. I'll pause for a moment there for any questions as well.
So when we talk, what is our baseline that we're using to compare this with?
As far as the overall baseline cost or the base?
How are we comparing the cost of this program to others? What are we comparing it to? In essence, aren't we saving money already, even though we had some upfront costs?
There certainly are upfront costs, and as you'll see in here, there are startup costs associated as well. Those are spread out for the first 3 years. I would say yes, overall, the city is saving money. Essentially based on what we projected though and what we sold, we have a methodology to come in and predict cost savings where we'll see your overall spend or your total cost of care decrease. So we do see that baseline jump 7.5 each year, or at least that's what we use here.
Okay.
The baseline that we're using, Don, is actually your previous 2 years prior to Vera.
And as you know, the claims experience fluctuates year to year. Sometimes we have good years, sometimes we have bad years. And so this is kind of a moving target. I think originally when we started this project quite some time ago, this was a long-term goal. I don't think anybody expected that, we're going to see a huge return in the first year or anything like that, but this is really for budgetary sustainability in the long run. So looking to the future.
Yeah, absolutely. And I also want to make a point that the goal is to provide a better service also. It's just not about the dollars, although that is very important.
Yes, definitely high quality care at a sustainable price.
Yep.
And this is just a sample. So PMPM is per member per month. Sometimes we refer to it as PPPM as well. As you can see here, this is a comparison of your year 1 to year 2 savings. So overall in 2021, higher medical spend plus 9.3, but lower pharmacy spend of 7.3 in year 1 compared to year 2. That's not uncommon, and that's what we're seeing with many of our other clients as well. As Marcy had noted earlier, the need for behavioral or mental health, as you can see, costs had the largest increase from the pre-Vera data, fairly significant there. And again, you're not alone. That's something that we're seeing amongst our other clients as well. And facility outpatient costs, some of that can be related to behavioral and mental health. Some of it can be related to physical therapy. That had the most significant change from year 1 to year 2 as well. All right, Marcy, I'm not certain if this is the area that Britt takes over.
Yeah, I think this is still you, James.
Okay. All right, good deal. Didn't look as much at this one, but we talked a little bit earlier about overall prescription drugs and just some of the trends that we're seeing here as well. So as noted, in 2020, an average of 3.8 prescription drugs running through Vera. That number significantly increased to 6.7 in 2021. Not uncommon again, as more people came into the care center and ended up seeing doctors, which they weren't doing previously.
And I think, really the prescription drug impact is something that was more unexpected. I don't think I think we knew it would impact, but not have as a significant impact. And so that's why I really wanted to share that information with you all today, that it's a really powerful benefit. And, those positive comments that we receive, I can't tell you how many times I've heard that, man, it was so easy because I was actually able to leave the clinic with the drug I needed and not have to go to stop 2 at the pharmacy. And so I think, that's messaging that in the future, We obviously are going to be improving our education for our employees and their families. And that's just another strategy that we have, is to really market how convenient this service is for our employees and their families. So I'm going to, at this point, if nobody has any further questions for James, we're going to hand it over to Britt to talk about the future with Vera and some strategies around partnership.
Thanks, Marcy.
Councilmember Schwab or Vice President Tui, do you have any questions?
I don't at this time. Thank you.
Okay, great. Sorry, thanks. Go ahead and move on.
Yeah, no problem. So when we were right before the pandemic, we were working with the city on strategies in which you might be able to find strategic partners to share in some of the fixed costs of what the clinic, was costing the city. And, from our perspective as a consulting firm, we've got a pretty big footprint, not only in, the King, Pierce, and Snohomish counties, but really, throughout the state of Washington. And, when we look at employers that reside within Snohomish County, there's some notable employers that are very similar to you when it comes to, being self-funded. So, being on the hook for your own claim liability, where a clinic strategy does have the ability to be able to control costs on a very significant level. And so, when we look at employers that are hanging their hat within Snohomish County or, close proximity to where your clinic is located, there are some strategies that we will look at doing to try to find you, or to try to help you find strategic partners to help bear some of that additional overhead expense, knowing that there might be some capacity within the clinic to do so. So first here is, Alliant has stated, we are one of the largest, if not the largest, brokerage firm within the Washington marketplace. And as a result of that, we have a lot of clients, not solely within Snohomish County, but all throughout the state. And by leveraging our book of business and the relationship we already have with our clients, that's one way in which we can look at, finding the right strategic partner. It's a very similar footprint, funding arrangement, et cetera, vision for what employee benefits look like with a clinic model as the city of Everett. We will also rely a little bit on Vera. Vera has their own sales team, and they have their own relationships with other employers within, your given geography and proximity. So, I think the two of us, are always looking for strategic partners to be able to help bear some of the costs that you're seeing. From a pure prospecting and cold lead cultivation standpoint, we do have 13 consultants within the Seattle office that, are sales individuals and professional sales individuals that are always looking for ways of gaining an audience with a potential client that might be a good fit for something like this. So, the use of email and regular snail mail marketing is something that we're accustomed to. We do have a team that makes cold calls, especially around strategies such as this, to try to pique interest of employers within your own geography. And then we also, have employed, as an example, putting on a webinar about the clinic experience. And it's something we were working on with Marcy and team right before the pandemic. And, everything kind of got dragged down to a halt a little bit, just as a result of, people not really being in the office and, the challenges that the pandemic presented. We also believe that, the city of Everett has unique relationships with employers that do business within your city limits. And those relationships, whether it's political relationships or business to business relationships, those can also be very valuable as well. So, if there are employers out there that we've identified or we've helped you identify that would be a good fit for this solution, we can also work with you and, your leadership team to determine what the appropriate course of action is when trying to find partners for the clinic that would be a good fit within your own geography. The other thing that's out there that you may or may not be aware of is there are associations which hold monthly meetings or weekly meetings or bi-weekly meetings or quarterly meetings where there's always a spotlight of an employer or the opportunity to give a presentation to an audience of an employer doing something creative within the market in which these associations reside. So for instance, SHRM is a human resources association which has chapters all throughout the state. The EASC is also the Economic Alliance of Snohomish County, is also one of those avenues which, you know, I've been to a couple of their meetings in person and online, and they're very well attended, which would give us the opportunity to potentially do a client spotlight with the city of Everett and your experience with the clinic in a way to promote the potential partnership that you might be able to find within your market. So these are just some ideas and things that I think, you know, when we're looking at costs and we're looking for cost mitigation strategies and partnership opportunities, these are things that, you know, being your consultant, I think we're equipped to not only be able to help you out with, but to be able to strategize about, you know, what this could look like going forward.
James, did you have anything to add from the Vera perspective at all on that?
I guess I could say that, you know, there are, as Britt kind of alluded to, you know, some of the same initiatives that we're doing as well to engage and focus on at-risk population. A big thing that we're doing at a patient level is high and rising risk outreach and communicating with those individuals that are the highest cost to the city of Everett, and a big focus on diabetic measures as well. As some of the other pieces, no, I would say I don't really have anything to add at this point, but happy to take any questions.
So I think that concludes my portion of the presentation. Does anybody have any questions for myself or Britt or James at this point?
Well, this is Council President Stonecipher. I'll just ask, sorry, I'm in my car now, so I'm going to keep my camera off. What is the capacity? I mean, are you at full capacity, or do you have capacity available in the clinic for other, you know, businesses to join us there, or would you have to add significant staffing, or how would that work if you were able to expand the what you're offering our community?
No, that's a great question. So we do have capacity. We have a total of 6 exam rooms, and I would say that we commonly use about 4 of those on a regular basis, even though they would rotate. There certainly is room for not only additional members to be seen at the care center, but also as there is a greater need or demand, we would also or could hire other individuals as well. I would say that at this point, though, we can increase capacity probably by a good 15% with the staffing that we have today.
And I can't remember our contract, but whose responsibility is it to, you know, to find those partners? Is that on the city to find people to come join and maybe consider that, or is Alliant working on that, or is our Vera people working on that? How does that come about?
Well, this is James from Vera. I would say that Vera is always selling and always looking for partners who are interested. We do have a couple of prospects right now, a couple of opportunities that are very close that could certainly utilize the Central Everett location in 2023. And I'll let Marcy answer the rest of that question as well.
Yeah, and I think Brenda, the contract language, if I recall correctly, it basically just says we will jointly work together. I mean, it's worded a little bit better than that, but it's in conjunction between Vera and the city. And then Alliant, as our broker, obviously has contractual obligations to support us in that type of venture. but it's basically that Vera and the city will, jointly work together to identify partners that will work for our capacity as well as our employee base, et cetera.
Okay. Because as I recall from the beginning, we recognized that it was probably a even better financial move if we were able to find somebody to help partner and bear those costs. We could get economies of scale of running a clinic.
Correct. Yeah, I think it was, I think some of the prospective clients too, that we initially, this was obviously pre-pandemic, right? When we were kind of feeling other agencies out, we're kind of hesitant and kind of on a wait and see. And so I think now that we have some experience under our belts, that hopefully we are, moving on from the pandemic, that this is kind of the opportune time to start those efforts again and really work with Vera and Alliant to bolster. I can already tell you that I've, been on a couple of webinars where I've presented about our experience with having a near-site clinic and the results that we've seen. So, we've been kind of quietly starting to do some work on this, but, we understand that from a financial sustainability model that we can really rev up now, I guess is the best way to put it.
Yeah.
Yeah, Marcy's been my apologies.
Yeah, I think in my day job, my clients' healthcare premium increases are double digits now, so maybe it'll soften some people up and having them thinking a little differently about what they might do. Thank you. Councilmember Schwab, Vice President Tui, do you have any questions?
Now, are we going to look at projections going forward? Is that coming?
So the 2023 budget, is that?
And beyond, I mean, do we have projections how this program is going to move going forward as far as the costs?
Yeah, so I know Susie has some information included on her slides as far as the budget and what that looks like for 2023, but I'm happy to, work with her to forecast beyond that. And I think a lot of it is kind of dependent on, can we establish some sort of partnership between now and then? That would really change, I think, those projections.
Well, obviously it's going to be a moving target.
Yes, exactly.
But I am interested to see what some of them, you're saying the main variables is a larger grouping of patients.
Mm-hmm.
Okay. And so how many? And
it really depends on the employer, the potential employer size or additional, the employer that we would partner with. So I don't, James said that initially we could probably take on 15% an increase in capacity. But if it's a larger employer, then that would play into it as well. So I think we could probably all work with Vera and see if we can kind of model, maybe a small, mid, and large employer and what that potentially could look like.
Has there been thought of reaching out to some of the cities that are close in proximity? It seems to be a model. Mm-hmm. As far as the type and sample of employee. We could get an employer that has a more hazardous type occupation and change their user rate, those sort of things. I thought, has there been any thought about asking other cities or even the county, any like jurisdictions? Thank you.
Yeah, I can, and James can probably speak a little bit more just based on their client interactions. We have talked about, for example, City of Marysville, Snohomish County, those in the surrounding areas, maybe even some agencies a little bit south of us too, because what we also find that can be sometimes challenging is that the employee base, works in Everett but doesn't live in Everett. And so that has been, and for Vera too, I'll let James talk about north expansion, but a good percentage of our employees live north of Everett. And so, again, strategically, where would we, kind of identify what the best and most practical employer would be, like a city of Marysville, for example. I'm just throwing that out there. We haven't talked with them, but we definitely have talked about how we would approach those types of agencies. And James, I'll let you talk.
We've thank you, Marcy. We've definitely had a lot of contact over the years with other public entities and municipalities. I would say that there's been varied interest. I think one of the things that's probably most appealing for this care center are some of the labor groups. In fact, the Seattle Area Plumbers and Pipe Fitters Industry Trust does actually pay for a 0.5 provider and a 1.0 medical assistant at the Central Everett Care Center. So to a certain degree, even though their engagement numbers aren't as high as we would like to see in that particular location, you could definitely say that they are a partner in that location, just based on the fact that they're paying for some of that FTE support. In addition to that, we have looked at, in recent years, some expansion, as Marcy noted, a little bit north. As she stated, a lot of city employees are living north of the city limits. And I think at this point, there's some talk of early 2024, the most expansion in the Puget Sound area for Vera initially will likely occur in the Pierce County, South King County area at this point. We have also, just very quickly, we're in negotiations with a couple of large payers who are local to the area. They would potentially attribute members who sign up for their plans and who potentially utilize Vera to utilize our network of locations. So within the Seattle area, we have 5 open network care centers that your members or employees and their spouses and dependents are eligible to go to. And in a similar fashion, with this particular payer, if they selected a plan and wanted to utilize the Central Everett location, they could do that as well, ultimately seeing more people in the door and lowering your costs.
Anything else to add? Hey, well, thank you all so much for your time this afternoon. I really appreciate it. And there's going to be more information to come on Vera and our health plans as we continue to educate and grow our benefit offering. So again, thank you for your time.
Thanks, Marcy. Appreciate all the information, and thank you to Alliance and Vera folks who are here to help us understand how we're doing. It looks like we're on a good trajectory and maybe have some opportunities to make it even better.
Yes, for sure. Thanks again, everybody. And I'll stop sharing my screen so you can take over.
Thank you.
All right. Have a great afternoon.
Thanks
so much.
Bye.
Council President Stonecipher, we do have one item left on the agenda. However, we're about out of time. It probably would take me about 10 minutes to go over what I have for you on budget amendment number 2, if you'd like to continue, or you could wait for the full briefing. It's entirely up to you.
I have time to continue. Councilmember Schwab, Tui, are you available for 10 more minutes?
Yes.
Okay.
Yes.
Well,
let's go forward.
Here we go. Share my screen, and just want to confirm that everybody's seeing my slides.
Yes.
Yes.
Okay, great. Okay, so this is just a preview of budget amendment number 2, which will be on the full council agenda on first reading and briefing on September 28th. We're still finalizing a couple of items for the amendment, but I'll be going over the list that I'm going to go over this afternoon is fairly complete. You'll find that it is typical of our normal budget amendment number 2 that we do every year, where we are appropriating several grants and then also distributing the vacancy offset that we have actually incurred thus far this year. And we have also a couple of other construction related items for you. So in total, we will be amending the budget by $16.9 million, which includes $1.2 million for the general government and $15.6 million for non-general government funds. Starting with general government amendments, we have 2 Department of Commerce grants for planning. These grants will help fund the implementation of the Housing Action Plan, including developing incentives to encourage construction of additional affordable market rate housing in a variety of types and prices, and planning efforts around middle housing. The police department received a couple of small grants for counterterrorism training and basic marine law enforcement training. Fire received a Department of Commerce grant for spill prevention, preparedness, and response equipment. And municipal arts received Snohomish County tourism and lodging tax grants to support horticulture, and a lodging tax grant to support the 4th of July celebration. We're also requesting $98,000 amendment to fund maintenance costs for the city's new grant management system, which supports CDBG, CHIP, and Human Needs Grant Administration, and software for lease management, which was needed to comply with new Governmental Accounting Standards Board reporting requirements for leases. Our legal department was successful in obtaining $61,000 in insurance recoveries for traffic signal damage repairs. We're also proposing an amendment of $8,000 in police overtime support for council. This will cover a partial year, and a full year has been included in the proposed 2023 budget. In 2021, the IAFF and city settled a new collective bargaining agreement in which new specialty designation of rescue swimmer was added. This agreement was settled after the city's budget process was complete, so the startup costs required for the program were not included in the original 22 budget. This amendment will increase the training and personal protection equipment budget for that program. Fire received reimbursement from Seattle Fire Department for training costs associated with structural collapse rescue, which is part of required continuing education. And we have jail fees, which are exceeding budget at an increasing rate. Both number of inmates and number of housing days are driving these numbers. The number of inmates through July are up 43% over the same time period in 2021, and housing dates are up over 49%. The primary driver in this increase is the court's are to issue bench warrants, which is impacting the level of activity. And the last proposed general government amendment is the distribution of the vacancy offset. Vacancy offset was distributed from the non-departmental fund to the funds where the vacancies have actually occurred, including police, facilities, municipal court, IT, parks, and the library. All open positions are being actively recruited, and none are being intentionally held open. For non-general government proposed amendments, we start with $553,000 for CIP1 to fund Fire Station 2, Phase 2, and an HVAC renovation project at the main library, and a renovation of the restroom and locker room at the South Precinct. For CIP3, we have $2.5 million in amendments for new playground equipment at Thornton Sullivan Park, a new roof, the design for a new roof at the Silver Dome, and funding for the Silver Lake Trail and also street overlay. Parks will be making improvements to the Lowell Riverfront Off-Leash Park and is asking to appropriate $83,000 from its reserve fund. The city has had a couple of large settlements and an overall increase in workers' comp claims. We are proposing an amendment of just under $3 million to cover those costs. The funding source is the self-insurance fund balance. Then, due to a 2-year build time schedule for fire trucks right now, we ordered the rigs early that were targeted to be replaced next year. Unfortunately, it looks like they will not be ready until 2024. So we will reappropriate the budget authority as necessary until we take delivery and make final payment on those trucks. And as everybody this year, to cover that additional cost in our motor vehicles division, who contracts and pays for that fuel. The motor vehicle division is an internal service fund, and it originally pays for the fuel and then it bills departments for the fuel that they use. And so we will be watching departments budget through departments that may need one as necessary later this year in budget amendment number 3. And additional funding is needed for the contract management and grant management software implementation projects. The last non-general government proposed amendment is for ARPA funds. We account for these funds in Fund 155, General Government Special Projects. Last May, Council received a briefing and adopted a resolution in support of moving forward with this list of projects, and this amendment provides the formal spending authority. And with that, that concludes what I have for budget amendment number 2. Are there any questions?
Yes, Susie, this is Councilmember Tui. I do have a question. On the self-insurance fund, what would our balance be after we move the $3 million out of that?
Our target balances for our tort fund is $4 million and our workers' comp fund is $1.5 million. Workers' comp will be at its target balance after that happens, and the tort fund will be slightly below its balance, and we have a plan to rebuild that over the next 3 years.
Okay. And so as long as we don't get anything else before the end of the year, right?
Well, we have one more, well, hopefully, yes. And we do have one more budget amendment planned towards the end of the year to accommodate should something else happen.
Okay. All right. That was the only question I have. Thank you very much.
You're welcome.
Councilmember Schwab, any questions?
No, I have no questions. Thank you.
Thank you.
Okay. Susie, I am just wondering, I haven't had time to, I have been locked out of my email, so I haven't had a chance to look at my email. Is there an itemization of the amounts for the ARPA funded project? And are those right on track with what we had considered or thought we were going to be spending at our initial briefing? It's been a while since we learned of all those.
Yes, that is what informed this budget amendment. So the total expenditures are $5.6 million, and individually that's spread over expanding pallet shelter communities, service coordination for unsheltered population, Chart 2.0, bridge design for Everett Point Industrial Center, digital permit accelerator, public restrooms, and the Clean Everett program. And the amounts in the budget and what you'll see in the tally that will be attached to the ordinance are the exact numbers from that resolution.
For each of those projects. Okay. So the projects are all just kind of coming in right where we thought they would be?
Thus far, yes.
And
okay.
Council President Stonecipher and others, we do intend to come back to council. We're doing that quarterly with updates on the ARPA funding and intended projects moving forward, as well as a look back at where we are with what we've already had council adopt through resolution. So the latter part of September, more likely, or possibly early October, we'll be back in front of council with that update.
Okay. And if those, and so we're going to appropriate the funds, if they come in under budget, those funds stay with the ARPA funding. Is that correct for us to reappropriate?
Yes, that's correct.
Okay.
As a matter of fact, we're going to be watching those projects, and we will do a full reconciliation at year end to see what balances remained, and we'll be bringing that forward to council for approval in budget amendment number 1 of 2023 to reappropriate whatever unspent money is necessary to carry forward. And these funds are being accounted for separately, so the money stays in the fund until it's needed.
Yeah, that makes a lot of sense. There's a lot of restrictions on them. And
Yep.
Remind me how long we have to spend the funds. I think it's both 2025.
Well, we have to have the funds at least committed by December 31st, 2024, and we have to have them fully spent by December 31st, 2026.
Okay, great. Thank you.
Sure.
That is helpful. And the jail fees, I feel like, was this something where we had originally increased our jail fee budget this year anyway? And are we even going above? Where are we in terms of historical jail fee expenses?
We are, well, our original budget was at a historic low for jail fees. You may recall there was quite a lot of discussion about that. They are coming in higher. We're still not up to where we were
pre-COVID,
because there's still other factors at work, the blank decision, a few other things. But they're certainly trending in that direction. So
okay, all right, that's helpful.
Okay,
all right, thank you. Any other questions, Councilmember Schwab or Tui?
No, I'm good. Thank you.
None for me.
Thanks,
Thank
Susie.
you for all the preparation work.
Nice work.
Yeah. Thank you, Susie. Very helpful. And remind me that budget amendment will appear on the council agenda when?
On September 28th.
Okay. Very good.
And
right.
Lori, thank you to Marcy and her preparation also.
I'll pass that along.
Absolutely.
We have a
Very, very helpful. All right. Well, and do we have any other business to conduct at our meeting today? None for me. Okay.
The agenda, yes.
When is our next budget finance committee meeting scheduled, Susie? Is that, do we have one in October to learn about the budget details?
Well, the next meeting we have is going to be on the 21st of September, and that's actually full council. So that is when the mayor will present her budget message, and then I will be presenting the details of both the sources and uses of all, both the revenues and expenditures citywide on the budget. And that's also a public hearing, which is required. And as far as the next budget committee, bear with me just one moment, and I will tell you. We have one tentatively scheduled for October 5th. And we don't have items identified for that agenda yet. So if there's something in particular that you would like to dig in deeper on, certainly could do that. And in the meantime, we'll be preparing any other loose ends that we might be able to share.
Or Council President Stonecipher, we could delay that October 5th Budget and Finance Committee meeting as well, if that is preferred.
I have a question, Susie. When will we be getting the budget books for review?
On October 13th is our target date.
I see. Okay.
That's great. Lori, we can touch base about future budget committee meetings. I'm not going to be at that October 5th meeting, so we may want to delay that by a week at least.
Okay. Sounds good.
Okay. All right. Well, with no further business, I have conducted our agenda. We are set to adjourn.
All right.
Thank you.
Bye-bye.
Thank you. Bye-bye.